Bismillah ar-Rahman ar-Rahim. My dear students of Ajman University, College of Pharmacy, second year course Pharmaceutics 1. Today we're gonna talk about transdermal drug delivery systems. This topic is not long, it's interesting. I want you to notice here that we are talking about systems, and systems are different when we compare it to a dosage form. Because dosage form we usually describe the state, for example, solid, liquid, etc. But when we talk about system, we are talking about more complex thing. Okay, we are not specifying a dosage form, whether it's solid or liquid. We are more interested in looking at the whole thing, which include the device that will facilitate the drug to reach its site of action or its targeted place. So in addition to the drug, we have something else that integrate the drug and allow it to do the required action and reach the target place. طيب, what you are supposed to know? You are supposed to tell me what drugs that would be suitable to be incorporated into a transdermal dosage form or drug delivery system. So what are these physical chemical properties? What are the physiological factors that can affect drug absorption? How can we improve drug absorption through chemical and physical means? What are the different designs of the transdermal delivery systems? What are the designs available? What are the advantages and disadvantages of using transdermal drug delivery systems? Give me examples of commercially available drug delivery systems. How you gonna counsel a patient to whom you have dispensed a transdermal drug delivery system? These are the things that you should be aware of. Okay, starting with the definition. What are these systems? These systems facilitate the passage, and this is very important, of therapeutic quantities of drug. Not subtherapeutic, not less than therapeutic, not more than therapeutic that may cause toxicity. So it facilitates the passage of therapeutic quantities of drug through the skin. Okay, that's why we call it percutaneous absorption, and into the general circulation. طبعا general circulation is the systemic circulation, okay, to exert their systemic effects. Systemic, not systematic. Okay. For the physiology or the histology of the skin, because we need to understand the skin in order to see how we can influence drug absorption and what can affect drug absorption. You see here the epidermis, this area here, and then you have the dermis. In the epidermis, the upper layer here is called the stratum corneum, consisting of dead epidermal cells, dry cells, etc. And this stratum corneum, the most upper layer of the skin, is a barrier. That's why, when a chemical comes to your skin, it doesn't go to your systemic circulation directly. Your skin will act as a barrier. This is something good. But at the same time, we need to use this skin in order to deliver therapeutic drugs into the systemic circulation. Okay? So we want to see how we can do that. So what we need to know now is that the stratum corneum is the major rate limiting barrier. شو يعني? What does it mean? It means You cannot control the rate of absorption just through the transdermal drug delivery system, because you have a barrier, and this one is the one that is controlling the whole process. Yes, you can do things, but and you can improve. For example, as I said previously, you can use the chemical and physical methods to enhance absorption, and this will improve it. But still the overall process is controlled by the stratum corneum. طيب, now how the drug moves from the transdermal drug delivery system and into the systemic circulation. It moves, or the process of absorption happens by passive diffusion. Passive diffusion معناته the drug will be transported, because شو will be passive diffusion? The drug moves from the region of higher concentration to the region of lower concentration. Where is the higher concentration? It's above the skin. Of a transdermal drug delivery system, we have more drug there. With lower concentration is in the blood. Now this difference will cause the absorption of the drug to continue from the transdermal drug delivery system to the systemic circulation. طيب, this stratum corneum, the formidable barrier, the strong barrier, consists of these three things, اللي هي protein, water, and lipid. And I want you to take notice of the later two, water and lipid. Why I want you to notice them? Because for the drug to leave the transdermal drug delivery system and gets through the skin, it must be, or it must have, water and lipid solubility, just like the nature of the skin. This will allow the drug to move. So what factors, we already talked about physiological factors. What factors, other factors that can also affect percutaneous absorption? انتبهوا, please pay attention. The transdermal drug delivery is also referred, or the absorption of the drug through the skin is also referred as percutaneous absorption. So what can affect that? First, the concentration. How much drug is in the TDS? Of course, usually we use high amount. Why we use high amount? Because we need that concentration gradient. We already explained that the drug moves by a process called passive diffusion. So the driving force is the concentration gradient. The difference between the concentration في transdermal drug delivery system and the concentration in the systemic circulation. Also the area. يعني how big is your patch, or your transdermal patch? How big is it? The bigger the transdermal patch, معناته the larger is the application area, معناته more drug gets to the systemic circulation. We also talked about drug, and we said that we need the drug to have attraction for the skin. And in order for that to happen, it must have some lipid solubility and some water solubility. This is very important. That's why you will see that unionized form of the drug is better absorbed than ionized. When non-polar is better absorbed than polar. Actually, polar drugs will be able to move between cells, intercellular. بينما lipid or soluble or non-polar drug can move transcellular, يعني through the cells. Okay. Other factors that pertains or linked to the type of the drug is the pKa of the drug. pKa can affect the ionization of the drug, how much ionized the drug. Also the partition coefficient, how much the drug loves lipid compared to water, will affect the drug absorption. Another factor related to drug absorption اللي هو molecular weight. طبعا if the drug has very large molecular weight, it will be difficult for the drug to be absorbed. So what is the good thing? The good thing is between 100 and 800. Molecular weight between 100 and 800. The ideal thing is to have molecular weight less than 400. يعني as you go above 400, the chance for the drug to be absorbed therapeutically will be less. Another thing which will affect absorption اللي هي hydration of the skin. How much moisture, how much water is in the skin. Of course, the more water in the skin, the better will be the absorption of the drug, because you have more medium for the drug to dissolve in. How this can be achieved? One of the ways for it to be achieved is through the backing area. شو يعني البacking area? Now this is the batch. Okay, let's suppose this is the batch and you have the skin is here. This backing area, okay, that is made from polypropylene and polyethylene, this backing area protects the batch, protects the patch, sorry, not batch, patch, protects the patch, and also it prevents moisture from evaporating from the skin, okay, and this will hydrate the skin. Isn't through the occlusiveness, because this backing layer is preventing the moisture from going out into the environment. It's occlusive. So through the occlusiveness of the backing layer, you will prevent the moisture from escaping, and this will hydrate the skin. Another thing is that when the skin is thin compared to a thick skin, okay, thin skin of course will provide a better absorption area compared to a thick skin. Isn't depending on the site, okay, where you apply, the thickness of the skin can be different, and this can cause different absorption. Thin skin will absorb drugs better, or will allow the drug to be transported through the skin better. Residence time is how much or for how long, what is the period I'm going to keep this transdermal drug delivery system on the skin. طبعا the longer it stays, of course, the longer it will release the drug. If I just remove it quickly, it will not have chance to absorb, for the drug to be absorbed or transported. Okay, so let's now talk about enhancers. Okay, those things that we can do in order to enhance the transport of the drug through the skin, because as I said, the stratum corneum is a barrier and we need to do something about that. So one of the ways is to use chemical enhancers. Now what do? They affect permeability, نفاذية, porosity, or how easy for the drug to cross the skin. They affect that, they improve it by reversibly. Reversibly يعني once you stop, everything will go back to its normal way. So reversibly damaging or altering ايش البروبرتيز تاعت الستراتم corneum, so that it reduces the diffusional resistance, its resistance to ايش for the drug to diffuse through the skin. Okay, so how does it do that? One, اللي هي عن طريق through hydration. 2 through changing the structure of the intercellular channels. As if you remember, polar drugs will go through intercellular channels. So it can improve that channel, it can make it bigger, and this will allow the polar drug to pass through these channels. How does it do that? It will, you have lipids and proteins there, and it do that by solvent action or denaturation. إذا في عندنا one way hydration, 2 through acting on the intercellular channels, or it can do both اللي هو increased hydration و change fill channels. It's very important that when you select the suitable chemical enhancer, it should not be toxic, so it should not have toxicity to the skin. It should be effective in doing the job, and it should be compatible. Yani goes well with the skin. It doesn't irritate the skin, for example, and it has good physicochemical properties to be incorporated with the drug. Examples عليهم, we have acetone, dimethyl acetamide, dimethyl formamide, dimethyl sulfoxide, ethanol, oleic acid, polyethylene glycol, propylene glycol, sodium lauryl sulfate. On the other hand, you have the physical enhancers. Now, so far I'm not aware of any drug, not for cosmetic purpose, any drug, or for not for pharmacological drugs. I'm not aware of any transdermal drug delivery system that uses physical enhancers for delivery of a pharmacological or active drug. I'm not aware of that, okay? But there are studies on that. Now, what are the methods that we have? The methods we have, one is iontophoresis. For iontophoresis, it makes the use of electrodes like a power, like a battery. You have the positive electrode and negative electrode. If your drug is negative, يعني ionized negative, okay, then you put it in the ash with the negative electrode. Then you put it on the skin. What happens? The negative electrode will push the drug through the skin because they have ash, the same charge. Here is another illustration. You have positive drug and you have positive electrode, and this will force the drug through the skin. This is referred to as iontophoresis. So the drug moves because of the electrical field. The other way, or the other physical method, اللي هي sonophoresis. Here it uses high frequency ultrasound, okay, and this high frequency ultrasound will create imbalance في المembrane of the cells that will allow better drug to move through the skin, okay. And we have examples of studies that used lidocaine, dexamethasone, insulin, verapamil, propranolol, salicylic acid, hydrocortisone. So we have some examples. Now let's talk about the design. And here we have two design for transdermal drug delivery systems. We have the monolithic, and we have the membrane controlled systems. So that we have two. Monolithic, let me just explain to you what do we mean when we say monolithic. Monolithic means the whole unit, okay, the whole transdermal patch act together as one unit. Mono means one, okay, so it acts as one. The whole system acts as one. So the explanation for this can be shown in the figure. Here you have the film packing, okay, the one I told you about, will provide occlusiveness. So what will this do? First, it will prevent anything from environment to go inside. It will prevent the drag to go outside. It will prevent the moisture also to evaporate, the moisture from the skin. Okay, so this is something good. So the drag only have one way to get through the skin. Type. Then you have the drag matrix, and this is the drag matrix. It has drag plus polymer that controls the release of the drag in a gel form, and you might have adhesive with them. Okay, and here you have a protective liner at the end here, and that you remove only when you want to apply the transdermal patch. On the other hand, when we talk about membrane controlled systems, we are talking about a design where you have a drag reservoir. See, this is the drag reservoir. It's like a pouch, like a container, okay, containing the drag in the form of liquid or gel. And of course you have the packing. Again, this packing, as I said, is to prevent moisture from evaporating from the skin. That's why it helps in skin hydration. It also allows the drag only to go one way, and that is into the skin. It protects the system from environment, okay, what happens outside. And this packing can be transparent, the color can be transparent or pigmented, and made from polypropylene and polyethylene. This membrane here, this is the one that is responsible for what? Controlling the release of the drag. That's why they call it membrane control system, okay? And it's made of polyethylene with very small pores to allow the drag to move outside from there. And then you have the adhesive layer. This adhesive layer is made from polybutyl acrylate, and it's pressure sensitive. Yani in order for it to stick, you have to apply pressure on the backing area with your hand heel in order for it to stick on the skin. And then you have here the protective liner or peel strip, and this you remove it only when you want to apply the transdermal system. Now, the question, which one is better or has better characteristics, can control the release of the drug in a better way? The answer is the membrane controlled systems. They have the advantage in the constant release of the drug through the membrane. Okay? Okay, now let's talk a little bit about this adhesive that I was talking about. Adhesive here. There are two types of this adhesive. في عندنا البريفرال وفي عندنا الفيس. طيب الفيس is more common and may be preferred. Okay, what does it mean? Peripheral means that the adhesive will be only in the peripheral area, to not be the whole face of the transdermal system, okay, transdermal patch. No, only in the edge. That's why they call it peripheral. أما الفيس, it's the whole thing. طبعا الفيس is preferred in that sense because it can stick better to the skin and it's the more common. When we design the transdermal drug delivery system, what is our objective? يعني if I ask you, for example, please design a transdermal drug delivery system, what do you have to take into account in your device, in your design? First, it should deliver a drug in an optimal rate so that you get a therapeutic level of the drug in the systemic circulation. Another thing is you will think about the drug. It should have the right characteristics to allow it to leave the system and go to the stratum corneum. The system should occlude the skin so that only the drug goes one way, and that is through the skin, and of course does not allow skin moisture to evaporate, does not allow environmental things to get inside. So this is the requirements from the transdermal delivery system. Also, one of the desired thing is that when you do a transdermal drug delivery system and you want to sell it to people, you should have an advantage. You should tell them, well, take this transdermal, it's better than taking, for example, an oral tablet. You have to tell them like this. So there should be a therapeutic advantage over other dosage form. What is the advantage? Okay? Otherwise, people will not buy it. It will be expensive. Also, another important thing, you don't want your transdermal patch to irritate the skin or sensitize it. Also, you want it to adhere well to the skin, to have good size, مش big size, with appearance of that to be normal. Okay, with site of application should encourage patient's acceptance, because if I tell you, okay, put it on the nose, on the forehead, then you will not do that, because you don't want people to see you outside wearing these things. They will start looking at you. Okay? But what are the advantages and disadvantages of transdermal drug delivery systems? One, you are avoiding the drug getting into the GI where, you know, there is a problem of pH, there is problem of enzymes. If you take more than one drug together, you might have some interactions between them. Also, if someone is having diarrhea, you cannot give him something oral, or you will not prefer to give this patient something taken orally, because it will not stay in the GIT for long. The same is for vomiting. If someone is vomiting and you want to give him something oral, the drug might not stay enough in the GIT or in the stomach. It will be expelled out by the vomiting patient. Also here, there is an advantage that you are avoiding first pass metabolism. And remember, what did I tell you with this one? I told you if a drug is taken orally, it goes to the stomach and then intestine, and while it's absorbed, the first place it will go to is the liver. This is the first place, through the portal vein. And the liver can reduce significantly the amount of the drug that gets to the systemic circulation. While with transdermal drug delivery system, you don't have this problem, because the drugs goes to the systemic circulation directly. Also, the transdermal drug delivery system is non-invasive method. It's not like doing a surgery or giving an injection where there is needle. Okay? So it's non-invasive, non-painful. Also, one of the good things about the transdermal delivery systems is that usually it provides extended therapy. Sometimes, for example, for 1 week, you are putting one patch only. And this can result in patient compliance. Okay, because the patient will find it easily to remember, easily to put. Okay. Also, such transdermal systems, they are suitable for drug with short half-lives. شو يعني short half-lives? What does it mean? Short half-lives drugs. Those drugs that are eliminated from the body in a short time, quickly. they get eliminated quickly. So if, for example, you want to give an oral tablet, you have to give it every maybe 2 hours or 3 hours. You give a tablet. But because of the reservoir, drug reservoir, the transdermal drug delivery system, you can put enough drug for it to continuously get absorbed through the skin. Okay? So you will have continuous absorption for longer period of time. Another good thing is that if you want to stop the medication, you just remove the patch, the transdermal patch. Remove it, and then you terminate the medication. This is unlike when you give a medication orally. If someone swallows the medication, then it will not be easy to remove that medication. Another thing is that, for example, if you receive someone who's unresponsive or unconscious and you don't know what medication he's taking, if it is transdermal, then you will know, because you will see it on the body or on the skin of the patient, and you can identify it and you can know what kind of drug this patient is taking. The disadvantage is that it's suitable only for potent drugs, معناته drugs that are used in small quantities to give an effect. Okay? Because as I said, drug absorption through the skin is not fast. So you need only small, so the small amount of the drug that gets absorbed, you need it to give effect. So this is one thing. It's suitable for potent drugs only, because skin is impermeable, يعني it's not permeable. And the other problem is that with some people it can cause irritation and sensitivity. We call it contact dermatitis. Okay, these are the two disadvantages of transdermal drug delivery systems. Now, what are the examples? If I ask you, give me examples of transdermal drug delivery systems that may be available in UAE. So what are they? One, you have the scopolamine, transdermal scopolamine. What is this used for? It's used for travel-related motion sickness. Some people, when they travel by sea or by air, they suffer from motion sickness, and they feel like, they cannot eat anything, and they feel like dizzy and nauseated. And also from people who were in surgery and were receiving anesthetics, okay, general anesthetics. Those people will not be allowed to eat after the surgery, otherwise they will vomit, okay, because their belly or their stomach will not be feeling well. So in these cases they give scopolamine. So we have transdermal scopolamine, and the example of that is transderm scope. And this is the first ever transdermal drug delivery system to receive FDA approval. Is it the first one? From all transdermal drug delivery system was the transderm scope. It's small, 2.5 square centimeters, and it can be kept behind the ear in a place where there is no hair, like here, for example, you see here, okay? It can be kept there for up to 3 days, okay? So it's something suitable. The other example is nitroglycerine. And if you remember, I said nitroglycerine is used as a prophylactic in the treatment of angina, is to prevent the happening of angina, الخناق الصدري. Usually nitroglycerine, the popular way of taking nitroglycerine is not transdermal delivery system, but ايش sublingually. if you remember we talked about sublingual tablets. example كان nitroglycerin, and this is the usual way of giving nitroglycerin, but we have ايش also we have transdermal delivery system. طيب examples we have minitron, we have nitroderm, we have nitrodor, we have transderm nitro, we have diponate. Okay, these are examples. Now, how is it worn? طبعا you have to be careful and tell the patient that he cannot use it more than 12 to 14 hours each day. So they have to put it 12 to 14 hours and without nitroglycerin patch for 10 to 12 hours. The reason for this is the development of resistance to nitroglycerin. The patient will develop resistance to nitroglycerin. That's why we have to put it and then remove in a day, the same day. Okay, on the same day, it's used 12 to 14 hours and removed from 10 to 12 hours. Okay. طبعا the placement is on the chest, on the back, upper arms or shoulders. طيب clonidine, transdermal clonidine. طيب we said that transdermal scopolamine was the first to receive FDA approval. Clonidine was the first hypertensive drug to be approved. Okay, it was the first one to be approved for hypertension. Okay, isn't for the condition hypertension, it was the first one. It's available be a product called Catapres. Type TTS means transdermal therapeutic system. Okay, you will see this TTS a lot. So we have transdermal drug delivery system and we have transdermal therapeutic system. Okay, and see this patch is applied and releases the drug over 7 days. And every week you will change it once. The good thing about clonidine, which makes it excellent as a candidate for transdermal drug delivery system, sure, the good thing about clonidine, it has good lipid solubility, and you know our skin has lipids. Okay, طيب, that's why it will be absorbed good, not through intercellular but through transcellular absorption. Another thing is the volume of distribution. It has high volume of distribution. And let me explain this to you because it is something related to pharmacokinetics. Volume of distribution means when the drug gets absorbed to the systemic circulation, it gets removed from the systemic circulation and concentrated in some areas of the body. So the blood will have little of that drug because the drug goes to specific places. Okay? But when the blood has little, remember the diffusion process, passive diffusion? We said the drug goes from high concentration to low concentration. Low concentration in the blood. طيب, because of high volume of distribution, the concentration of clonidine will be very, very low in the blood. Okay? And the good thing is it's effective in that low concentration. Okay? Where do you put it? You put it in the upper outer arm or chest. Example number 4, transdermal nicotine. Oh, here it reminds us of cigarettes. Now, you know, people who are addicted to smoking cigarettes, they have problems quitting smoking. What they found, they did a clinical trial. They recruited some smokers who want to quit smoking. They recruited them into this clinical trial and they divided them to 2 groups. For one group, they gave them transdermal nicotine. and for the other group they gave them ايش placebo يعني transdermal placebo containing no nicotine. Of course it was blinded study يعني the investigators and the patients did not know whether they are taking nicotine or not. You know what they found at the end? They found that those who are taking transdermal nicotine are two times more likely to quit smoking compared to those who took placebo. Examples من الترانسديرمال نيكوتين في عندنا النيكودير ونيكوترول. Okay. Now usually the dose of nicotine في nicotine patch ranges from 7 to 21. Now what do you start with? Okay. Do you continue with the same dose? No. First you start with the highest dose and then you go down to the smallest dose. But what is the highest dose? Do you start with 21? Not necessary 21. If the smoker is not heavy smoker, you might start with less than 21. So the starting dose depends on how the smoker or how heavy the smoker was. That's why the period for administration and therapy, the period extends from 6 to 12 weeks depending on how heavy the smoker was. Okay. It's important to tell the patient not to smoke when the patch is on. Also, it's important to only wear it during the day and take it off at night. معناته you'll be wearing it for 16 hours because you will sleep for about 8 hours. Example number 5 is estradiol, transdermal estradiol. Now some women, they will have symptoms, menopausal symptoms, or symptoms occurring because of other conditions, such as the night sweats, hot flashes, and flushes. These are the symptoms. Okay. Now it can happen because of menopause or because of some other conditions. Okay. So in this case they will need estradiol to relieve them from these symptoms. Where this patch will be applied, it will be applied to the trunk of the body, meaning in the abdomen or the upper quadrant of the buttocks. Examples عليها Vivili, Climara, Estradaire. These are examples. Now how you do or how the therapy is managed, it will be applied every 4 weeks. It will be applied for 3 weeks and then 1 week off. Every week you will use 2 patches. يعني every 3.5 days you will use patch. So every week you use 2 patches. So that will be for 3 weeks and then 1 week off, and then you repeat. The other example of transdermal drug delivery system is contraceptive system. Contraceptive system معناته it's for women, married women, who do not want to be pregnant. So they want to avoid being pregnant. That's why they may use such transdermal system. Example of that اللي هو إفرا. And they contain 2 hormones, one from progestin اللي هو norgestromine, and the other one اللي هو estradiol, the previous one that we talked about for menopause, اللي هو an estrogenic hormone. Okay, so we have a progestin and estrogen. They will be applied, or this type of transdermal system is applied once a week for 3 weeks, and then the 4th week will be taken off. Okay, so similar to the estradiol. Okay, but this is 1 patch per week. The other example اللي هو ايش؟ testosterone. And transdermal testosterone is applied as a replacement therapy in men who have deficiency or absence of testosterone. Examples اللي هو تستوديرم واندروديرم. The last patch we will talk about اللي هو methylphenidate. Now this patch is used for children who have attention deficit hyperactivity disorder, ADHD. Why specifically for children, and why it's suitable and desirable in children who have this condition, who cannot focus? Because it will start working 2 hours after it is applied. يعني after applying the transdermal patch, after 2 hours of applying it to the children, it will start working. And we apply it over 9-hour period. طيب, why? So why is it so suitable and nice? Because, you know, children, they go to school, and those who have attention deficit hyperactivity disorder, they cannot focus with the teachers and they will have problems. So this methylphenidate patch will start working 2 hours after you apply it to the child. So when they get up in the morning, when the child gets up in the morning, you apply the patch, and then the child takes breakfast and then goes to school, and then when the class starts, it's already 2 hours. So it will start giving effect-ish 2 hours after applying it. So the child will be able to focus. And when they come back, it's already 9 hours past, so you can take the patch from the child, you can take it off. طيب, transdermal methylphenidate is available with a trade name Daytrana, and it's available in different doses, 10, 15, 20, and 30. But these different doses, انتبهوا, it's not because you are adding extra drug in the patch. It's because you are using different patch size. Okay, so it's available in different patch size. Okay, now the last thing we want to talk about اللي هي counseling points or clinical considerations when the transdermal patch is used. First of all, when you dispense such a product, you should be aware of what is written in the leaflet, اللي هو what we call it the package insert, because the patient needs to apply it to the site exactly given by the leaflet. لأنه this is the site where clinical trials were carried out, في هذا السايت. النتائج كانت from that site, which is in the package insert. If you want to apply it to another site, it might not give you the right results, because the absorption might not be the same as what is written in the leaflet. Also, you should advise the patient to apply it in a clean, dry place, not in a hairy place, or where there are cuts, injuries for the skin, or the skin, there are oil, or maybe the skin is irritated. Also, you should ask the customer to avoid using lotion in that place, okay, because this can affect not only the sticking of the patch to the skin, but also the absorption of the drug from the patch and through the skin. Also ask the customer not to cut the transdermal drug delivery system. Someone might want to cut it, for example, to 2 pieces, so he or she can use it for a longer period of time. For example, instead of 1 in 1 day, he can use 2 in 2 days if the person cuts the TDDS. And that's wrong, because it can affect the function and integrity of the whole system. The protective layer that protects the adhesive, okay, from prematurely sticking, okay, you remove it carefully, and when you want to stick the patch on the hand, or sorry, not in the hand, yani on the skin, on that side, on the side where it should be there, you need to press with your hand, with the heel of the hand, for 10 seconds. Remember, I already explained that the polybutyl acrylate is pressure sensitive. So you need to press on it for it to work. Also, avoid putting the patch in places or sites where you expect rubbing to happen a lot, for example, near the waist. The application period, you should stick to the application period. And when it's done, then you need to replace the transdermal patch. For example, nicotine is used 16 hours, nitroglycerin from 12 to 14 hours. You have to stick to that. You need to clean your hand thoroughly before and after applying the transdermal drug delivery system, because the system can contaminate your hand. لأنه sometimes you already have drug in the adhesive. في الadhesive you already have some drug, so it can come to your hand. And also you don't want anything from your hand to go to the system. Another thing is, it is possible that when the transdermal patch is applied, the customer might get irritation or sensitivity reactions, and in this case you should ask the patient to seek medical help. طيب, now suppose you want to go and use a new patch, a new one, and how will you do? How will you dispose the old one? Okay, what you do first, open the new the package of a new patch, open it, okay, remove the new transdermal drug delivery system, remove it, and then you have the pouch or the package of the new one, right? You have it now. You have the package that from which you removed the new patch. Like, what do? You go to the old one that is stuck on your skin, you remove it from your skin and then fold it, and then put it in the package of the new patch, okay, and then throw it away, because you don't want anyone else to touch it, because you know some drugs will still be there في الpatch, okay. This is how you get disposed of the old patch. I hope you enjoyed today's lecture. Have a nice day. Take care. Bye bye.